Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mujahid Buneri. Welcome to the channel Dr. Mujahid Buneri. I hope you are doing well. Today I will discuss about celiac disease. But before coming to the topic, I want to tell about the learning objectives of today's lecture. It includes number 1. What is celiac disease? Number 2. What are the clinical features of celiac disease? Number 3. What investigations will you advise to diagnose celiac disease? Number 4. What are the complications of celiac disease? At the end of today's lecture, I will ask 3 questions. You will search the answers and give your answers in the comment section box. Okay, let's begin. What is celiac disease? It is a serious autoimmune disease where the ingestion of gluten leads to damage in the small intestine. What is autoimmune disease? Autoimmune disease is a condition in which a person's immune system mistakenly attacks its own body tissue. What is gluten? Gluten is a protein found in wheat, rye, and barley, etc. When people with celiac disease eat gluten containing diet, their body produces immune response that attacks the small intestine, which leads to damage of the villi. Villi are small finger-like projections that line small intestine, which promotes nutrient absorption. When the villi get damaged, nutrients cannot be absorbed properly into the body. Celiac disease affects 1 in 100 people worldwide. Celiac disease is a hereditary disease, meaning that it runs in families. People with a first degree relative with celiac disease have a 1 in 10 risk of developing celiac disease. Celiac disease can develop at any age after people start eating foods that contain gluten. As people start weaning in childhood, usually at 6 months, so this disease commonly occurs after 6 months of age in childhood. If celiac disease is left untreated, it can lead to additional serious health problems. For example, people with celiac disease have twofold greater risk of developing coronary artery disease and a fourfold greater risk of developing small bowel cancers. Similarly, untreated celiac disease can lead to the development of autoimmune disorders like type 1 diabetes mellitus, multiple sclerosis, and Hashimoto thyroiditis, etc. Okay, what are the differential diagnoses of celiac disease? It includes inflammatory bowel disease, intestinal parasites, irritable bowel syndrome, and cystic fibrosis. Okay. What are the clinical features of celiac disease? Most common clinical features of celiac disease include number 1. Chronic diarrhea. Diarrhea which lasts for more than 4 weeks is called chronic diarrhea. Number 2. Abdominal pain and bloating. Number 3. Steatorrhea means foul smelling fatty stool. Number 4. Nausea and vomiting. Number 5. Weight loss. Number 6. Signs and symptoms of complications, for example, iron deficiency anemia, which includes easy fatigability, pallor, etc. Okay. What investigations will you advise to confirm the diagnosis? It includes serological blood tests and small bowel biopsy. Serological blood tests include number 1, IgA anti-endomysial antibody. Its sensitivity is 99% and specificity is more than 90%. Number 2, anti-tissue transglutaminase antibody. These tests have high sensitivity in patients presenting with classic symptoms and have complete villus atrophy, but they are only found in 30 to 89% of cases. Of course, the most accurate test for confirmation of diagnosis is small bowel biopsy. Okay. How will you treat celiac disease? At present, the only effective treatment is a lifelong gluten-free diet. No medications exist that prevent damage or prevents the body from attacking the gut when gluten is present. Strict adherence to the diet helps the intestines to heal, leading to resolution of all symptoms in most cases. And number 2, nutritional support. Okay, what are the complications of celiac disease? It includes iron deficiency anemia, osteoporosis, small bowel cancers, neurological problems, and other autoimmune diseases. Coming to the last portion of my lecture, it includes today's questions. Number 1, what is the most common disease amongst celiac disease, inflammatory bowel disease, and cystic fibrosis? Number 2, which vitamins and minerals deficiency can occur in recently diagnosed case of celiac disease? Number 3, which small bowel cancer is commonly occur in celiac disease? This was all about today's lecture. Thanks to all for being watching my lectures.